Hello, my name is Carly Miller. I'm going to be showing how to insert an NGTube. Um, First, you're going to assess the patient's need for the NGTube for needing of enteral feeding. You're going to look at their medical history. You're going to check for any nasal problems or anything that may contraindicate having a tube go through their nose into their stomach. You're going to assess their mental status. You're going to check the doctor's order for the type of tube and when it needs to be put in. You're going to, like I said, checking the nose will be like checking the patency. You'll assess their gag reflex. You will find out if the doctor wants a prokinetic agent given before the tube replacement. And in this actual simulation, it is not needed. You're going to also take the bowel sounds before doing this. So first, what you're going to do with everything that we do, you're going to identify the patient with 2 patient identifiers. You're going to let them know what you're doing, answer any questions they may have. You're going to make sure that they're comfortable and have them positioned appropriately. You'll put a bath towel over their chest. So you'll place a bath towel. Dropping stuff. So I have tissues nearby because they may be needed. Okay. So the way we'll determine the length of the tube is you'll start at the tip of the nose. You'll go to the earlobe and to the xiphoid process, which is right here. So I have that marked with my fingers. I'm now going to mark that with a piece of tape. So that's perfect. Okay, now I'm going to get the tube ready. I'm going to inject water into the tube. I am going to make sure that the lure lock is fit snugly. And, prepare the tube fixation device. I'm now going to do hand hygiene, and I would have done hand hygiene before I checked the length, but I'm now going to don clean gloves. And you wouldn't be doing this on yourself in real life. So I'm going to dip the tube that has a surface lubricant into a cup of water. And we are using our imagination with this tubing. This is actually IV therapy. Okay, so at this point, I would put this in through the patient's nostril, let them know it's going to be uncomfortable. They may feel gagging sensation, that, it's not a fun thing to have an NG tube inserted. So you're going to go in, you're going to aim back and down. Once we get here, you'll have the patient tilt forward and tell them to swallow. I'm going to push the tube in as the patient swallows. Going to keep pushing. Let them know to keep pushing on, or not pushing on them, but encourage them to mouth breathe and to keep swallowing, because that's going to help this go down better. Right. Once I've reached, okay, here's the piece of tape. So we've gotten as deep as it's supposed to be. So now we are going to check for the position in the back of the throat. So we'll have them open their mouth and we'll look with our pen light. So, what am I forgetting? Check it in the back of the throat. Oh, so we'll listen for air exchange. So like when we get the gastric residual, okay, so we're going to pretend this NG tube is in me now. So what I'll do is we will push air with the stethoscope down here. We're going to push air. We got the stethoscope over the stomach. Push air quickly. We should hear like a pop or swoosh of the air. And then we're going to pull back just enough gastric juices. I'm sorry, I can't think of the gastric aspirate to use it on a pH strip. So we will test the pH of the gastric, which should be less than 5. If it's more than 5, then the NGTube is going to have to be replaced because it's not correct. So once it's in, we're going to anchor it to the nose with a piece of tape, and we go around it. It's going to be on both sides of the nose. You'll fasten the end of it to the patient's gown with tape. Sorry, I'm blinking. So once it's all in, we've already verified the placement with the pH balance. We put it to the gown, so we'll take these gloves off, do hand hygiene, make sure they're comfortable, make sure they're okay. Then we're going to get them to x-ray, because the pH balance helps us to determine if the pH balance is off, then we know it's not there, but we have to 100% get an x-ray because that's the only 100% way to tell that it's exactly where it needs to be. So once we get the x-ray, we're going to go ahead and do hand hygiene, do more clean gloves, do oral hygiene. We're going to clean the tube at their nose, everything we can get to. Okay, then we'll remove those gloves, and we're going to look at their nose and their oral pharynx, make sure everything's okay. We don't see any irritation, nothing out of the ordinary. Make sure and ask the patient if they're having any discomfort, if they're comfortable, if everything's okay. Auscultate lung sounds. And obviously the x-ray results, we know that we'll confirm the placement with that. Make sure that the patient is breathing okay, that their gag reflex is still good. And then we will chart that. We'll chart the type of tube we did. We'll chart their pH. We'll chart that we confirmed placement, how the patient did, how they tolerated the procedure. And I think that's it. Any abnormalities or anything will go to the provider, and that should be it.